Now, we're back talking with Dr. Victor Bozzone and the lovely Suzanne Summers, who is coming in via satellite from Santa Rosa, California. We're talking about bioidentical hormone replacement therapy, which is something, Suzanne, that you have really been pushing for many, many years. You've written like 25 books on this yourself and how it has benefited you. Let's concentrate, you as a woman, how it benefits women going through this. I mean, perimenopause is something that, it hits at an earlier age, it seems like. So how did it benefit you, and what did you do, and how does it affect women?
Well, it begins with you start having difficulty sleeping. You know, when you put a kid to bed, that child doesn't pray that they sleep tonight. They're going to sleep. They're making all the right hormones, and especially melatonin. But around 35, we start declining, not only in melatonin, but in all of our hormones start declining. Now, nature had one plan and one plan only, and that is to perpetuate the species. So as hormones begin to decline in women, the brain says, this person can't have a baby anymore, and that's when our first cancers are triggered. That's when the rheumatoid arthritis and hip pain and joint pain and body rashes and itches. It's quite an uncomfortable experience. And if you go to a regular allopathic only doctor, what you're going to get is a sleeping pill, you're going to get an anti-anxiety pill, you're going to get a diuretic for this unexplained weight gain, you're going to get cortisone creams for your rashes, when all you really need to do is go to a qualified doctor like Dr. Bozzone. He'll take your blood work, he'll see where your levels are, and individualized just for you, because what the woman watching needs is different than what I need. We're all individual, unique human beings. And you put back exactly what you've lost in the aging process and due to stress. And it's important initially to have some patience because it's alchemy. It's trying a certain amount and see if that works. And it's weird to call your doctor and say, my leg itches. But if your leg itches, that's your body saying, your balance isn't quite right. You'll know when you get your balance right. But what I find, what most people say, oh, I don't want to take hormones, I'm afraid of cancer. There has never been one reported case of cancer, not one, because of bioidentical hormones. In fact, young women do not get cancer unless it's something environmental. This is a new thing that young women are getting cancer, and it's usually some major toxic assault. But they are completely reproductive, and that's how nature has set it up. It's only as we get older and decline in hormones that the cancers are triggered. So they have done so many studies, and I put them in the backs of all my books so you can look up and feel confident about it. And synthetic hormones are not your answer. If you go to a regular doctor who hasn't gone back to study, like Dr. Bozzone, and where I met him was at an anti-aging conference, and there were probably 25,000 doctors there, and I love going to those conferences because these are all medical doctors who've been trained in their specialties, who've taken a big gulp and said it's expanded, they're going back to school. Hats off to you, Dr. Bozzone, for going back to school. I would tear my hair out if I had to go back to school. But these doctors understand the new way to age. It's a new way to age, and it makes aging great. I always want to shout it from the rooftops that, I'm 69 this year, and I've realized when you're a celebrity, you don't get your 9th year of your decade. Every article I read, Summers, who's turning 70 this year, I think, I haven't even enjoyed my 69th year. But I have never been in better health. My husband's on full hormone replacement. The two of us have the best time together. And
yeah, so
it
I
makes
heard from
aging an enjoyable experience.
I heard about your interview on The View a few years ago. You talking about the great times that you and your husband have together. It's like, wow.
I will never live that down. Well, but you're talking about sex and that we
that's part of it. It's part of getting old. It's part of getting old. I mean, the lack of it.
Hey, for women, no sex hormones. You don't feel like sex. I mean, you can do it because of your anatomy and the way we're set up, but most of the time you'd rather have a smoothie. A healthy person is a sexual person. If you feel good, you feel sexual. If you don't feel good, the last thing you feel like is having sex. So that's the only reason I talk about sex. Hormones, put your sex hormones back and you'll be back in the game.
Well, Dr. Vazone, I know that let's talk a little bit about women's health. We got just a couple of minutes in this segment. How it helps women and when you treat them. I mean, one of the things, you start out with the blood work.
Well, yes, as Suzanne points out, you start out with blood work to get a baseline, but one of the things I've found the most important in my practice is actually taking a good history of the patient. When a lady or man comes into my offices, I make it a point to sit down with them for about 45 minutes to almost an hour and ask them what is going on, exploring all of their problems so that I can get a handle on what exactly is dragging them down. Getting the blood work is a good thing to correlate with their symptomatology. And once you do that, then you can make an adequate prescription and start fine-tuning and adjusting their hormones so that they can actually get back to where they were 20 or 30 years beforehand. Going along with what Suzanne has said about when do you start this or how old can you do this? And my response to my patients is, the only time you can't do this is when you're dead. It doesn't matter what your age is. If you want to improve your life, you should investigate hormone replacement therapy, because the hormones govern everything that we do in our body. It's actually, the hormones are the conductors of the symphony, so to speak. They're making the music of the body play. And if you don't have a good conductor, you don't make good music.
Well, we got about 30 seconds left in this block, so we're just going to touch on again. We're talking to Dr. Victor Bazone, who is with Doctor's Care here on the Mississippi Gulf Coast, and also the beautiful Suzanne Summers out in Santa Rosa, California, who is a national spokesperson for Forever Health. And we're going to be coming back to her in just a moment, and we got to give the men some time and see exactly what it is exactly that the replacement hormone therapy can do for men. Well, her husband is a great testament to that. So we'll be back in just a moment here on our special segment today.